Good afternoon. Welcome to the weekly update of the COVID numbers, day 642. I'm joined here today with the St. Clair County Director of the Health Department, Mila. Mila, it's always good to have you here. Someday we won't get to be here, and I can't wait for that.
It's not today, though.
Not today. So you've got the numbers for this week.
I sure do. Good afternoon, everybody. For the reporting period of December 9th through December the 15th, we have 1,048 new positive tests out of 13,716 for the reporting period. The age range of those positive individuals is under 1 to in their 80s. The weekly county positivity rate is at 7.6%, with the 7-day rolling average match at 7.6%. The regional positivity was at 7.5% as of December the 12th. Unfortunately, we do have 7 new deaths to report today: a female in her 50s, a male and female in their 60s, a male and female in their 70s, a female in her 80s, and another female in their 90s. Our condolences go out to those families. Countywide, we have conducted a total of 592,036 tests, consisting of 44,711 positives and 547,325 negatives. Total number of deaths to date is 586. To date, the number of individuals who have completed their 10-day isolation period is at 42,661. Statewide, we have tested a total of 41,632,021. Total positive of that number is 1,921,433, which is an increase of 53,521 from last week. Total deaths to date is 27,013, which is an increase of 301. For St. Clair County hospitalization numbers, we have 63 patients hospitalized in St. Clair County with COVID-like illness. Regionally, we're at 144. Patients on ventilator in St. Clair County is at 4. Regionally, we're at 14. And Randy, I believe we have the graphic from our hospitals this week. Okay. So you can see that about 78% of those hospitalized are unvaccinated, 93% in the ICU are unvaccinated, and about 100 on ventilators are unvaccinated. Again, we encourage everyone to get their vaccine. Looking at our age breakdown for this week, you can see that 14.5% are 10 and under, 29% collectively are 20 and under, and 59% collectively are age 40 and under. So similar to what we saw last week with those figures. Okay. For congregate care, announcing those in outbreak status: Cedarhurst of Shiloh, 2 new cases; Cedar Ridge of Lebanon, 5 new cases; Freeburg Care Center, 2 new cases; Memorial Care Center, 1 new case; and St. Paul's Home, 2 new cases. We continue to offer vaccine at 330 West Main. In addition, now you can receive your flu vaccine there. If you go to our website at the Health Department, you can click on flu vaccine and register. You can also drive up to 330 West Main without an appointment for either vaccine for COVID or for flu, but appointments are strongly encouraged. If you need assistance making those appointments, you can dial 825-4447 Monday through Friday from 8 to 4. Again, we know that on Friday, IDPH endorsed the use of Pfizer boosters for the 16 and 17-year-olds. Again, with Omicron, the best tool we have in our tool belt is to get everybody fully vaccinated and boosted when that's available to you. Last week, we talked a little bit about the difference between third doses and booster doses, and I kind of wanted to recap because there was a little bit of confusion with the questioning there. So for the J&J vaccine, you receive 1 dose, and then 2 weeks after you're fully vaccinated. If you want to boost that, you can receive another vaccine of any type 2 months after that time period. For the mRNA vaccine, which are the Moderna and the Pfizers, for Moderna, you take your primary series, first and second shot, 28 days apart. If you're moderately to severely immunocompromised, you could be eligible for a 3rd dose. For those are individuals who are cancer patients or had organ transplants. And if you have a question about that, we encourage you to talk to your provider. Or if you come to 330 West Main, our healthcare professional there can assist you to determine if you meet that qualification. Okay, so again, you can get the that 3rd dose following that primary series. Booster doses are for 6 months after completion of your primary series. And the point that I was trying to make is depending on the type of vaccine that you receive and which vaccination dose, primary, secondary, 3rd dose, or a booster, that formulation may change. So for Moderna, the 1st, 2nd, and 3rd doses are the same, but that booster dose is about 50% of that formulation, so about a half dose. Where Pfizer, you receive your 1st and your 2nd dose 3 weeks apart for the primary series. Again, you can receive a third dose depending on your status, your health status. Booster at 6 months, which is also the same dose as the primary, secondary, or third shot. But then for the pediatric dose, the 5 to 11, that's about a third of the dose, a third of the formulation. So that's the point I was trying to convey last week. There's a really good article we have out on our website and social media that goes through all of that. We also have each of the vaccine information sheets out there that describe that. So if you have any questions, you can refer back to those resources or call the health department, 825-4447. Okay, Herb?
I was going to say, thanks for the clarification, and they can always call, like you said,
Right.
the health department, or they can stop by 330 West Main if they're, there to get their shot. If they're not sure,
Right.
the healthcare people there can help them out with that.
Right, and we are still offering pediatric clinics Monday through Wednesday in the evening. You do have to have an appointment for those. Parents can also receive their flu vaccine at that time, and some select Saturdays. So go to our website and see the availability on there.
Very good. We'll get into the zip codes right now. As you probably know by now, we have 27 zip codes throughout St. Clair County, and this week we've all of, except for 2 of them, got changes. 62201 goes up 19 to 925. 62203 goes up 18 to 1014. 62204 goes up 13 to 694. 62205 goes up 24 to 1050. 62206 goes up 36 to 2201. 62207 goes up 25 to 1094. 62208 goes up 75 to 2591. 62220 goes up 80 to 3132. 62221 goes up 83 to 4,237. 62223 goes up 73 to 2,712. 62225 goes up 14 to 316. 62226 goes up 103 to 4,743. 62232 goes up 25 to 1,345. 62239 goes up 23 to 785. 62240 goes up 4 to 261. 62243 goes up 24 to 1,071. 62254 goes up 22 to 1,072. 62255 goes up 4 to 144. 62257 goes up 8 to 509. 62258 goes up 37 to 1,588. 62260 goes up 28 to 1,107. 62264 goes up 23 to 552. 62269 goes up 128 to 5,062. 62285 goes up 24 to 816. And finally, 62289 goes up 3 to 73. So again, it's still out there in our community. All but 2 zip codes in St. Clair County had changes. Mila, you mentioned testing this week. The youngest was under 1 year old. So
Our case rate is still high. We're at 387, and anything over 100 is considered high. So obviously we still have a lot of transmission in the community. We're just under 59% fully vaccinated. As we move into the holiday season, large groups indoors, individuals who are traveling, we really encourage everyone to get their vaccine, try to become fully vaccinated prior to the holiday season, and limit that spread.
Well, and I had a phone call a couple of days ago. A citizen said, what is it going to take to make people understand? And I don't know, I'm lost for that. I mean, we've sat here for 642 days now, and we have begged and preached and gave them statistics, gave them information where they can find out. So it's everybody's, they're control of their own destiny, really. And you said the transmission is still out there. It's affecting all age groups. There's no particular group that it's not. Right. So I don't know what the answer is. I mean, I know you work every day. Okay. I wish you had that $64,000 question.
Right. And wearing the mask, washing your hands, staying socially distant, it works not only for COVID, but other respiratory illnesses, such as flu. So again, protect yourself during the holidays, especially as you're around large groups of people. We want to enjoy those days and not be ill.
Right. And for those of you who's been following us for those 642 days, you've seen the roller coaster of these numbers go up and down. We're back where we were this time last year with a little spike, as Milo says. It's still out there. You can help get those numbers down if you haven't decided or haven't done enough research on your own to find out if you want to get the vaccine, or stop and think about that. Talk to somebody. Talk to your healthcare provider. If they tell you don't do it, then follow what your healthcare provider is telling you. But if they've told you to get it, then there's no reason why you don't go get it. Make sure you follow up, get your booster, because as Milo said, that's the best tools we have in our tool belt right now is the vaccine, and it's proven. We've all been fully vaccinated, and we're here. So please consider doing that with the holidays coming up on us. As we said, you're going to have family over, you're going to have friends over. We surely don't want to see any more increases in these numbers. So that's all for day 642. We will be back next week with the weekly update unless something happens in between, and then we'll come back to you with it then. Everybody have a good evening.